Hello dears, next topic is diarrhea. So let's talk about diarrhea. Clinically we classify diarrhea into two types. One is called acute diarrhea, other is called chronic diarrhea. As you all know, acute diarrhea means the diarrhea occurring less than 2 weeks. If the diarrhea occur more than 4 weeks, we call it as chronic diarrhea. Talking about acute, we can again classify this into two types. One is called enterotoxic, other is called invasive. In enterotoxic, remember, there will be no fever, there will be no WBC in feces, or there will be no leukocytosis, that is WBC, or there will be no bloody diarrhea. But remember, when we talk about invasive, you will have fever, you will have WBC in fecus, you will have bloody diarrhea. Here it was watery diarrhea. Here surely the patient will be having bloody diarrhea. If there is WBC, if there is RBC or mucus or bloody diarrhea, this test that we call it as lactoferrin test positive. They are positive for what? Lactoferrin test. So what are the organisms that will cause you enterotoxic type of diarrhea, and what are the organisms that will cause you invasive type of diarrhea? Enterotoxic include a bacteria called Clostridium difficile. From the word only, someone taking recent antibiotics like clindamycin for pneumonia or clarithromycin or amoxiclav, they can have overgrowth of microflora, As a result, the patient will have diarrhea. At that time, for treatment, we give oral vancomycin. Second one, for enterotoxic, the main one, that is normally we call it as ETEC. ETEC is from unwashed vegetables and fruits. It is also called traveler's diarrhea. Next one among enterotoxic is Vibrio Cholera. If someone drinking unboiled water, rice water stool, they will cause you unboiled water. Next one is Staph aureus. Someone taking protein food like mayonnaise or like mushroom or something chicken, protein food. The main thing here, the incubation period is less. It's around 6 hours. So it will be like vomiting within 6 hours. After taking food poison happen and the patient start vomiting within 6 hours. Think about Staph aureus. Next one, there is something called Bacillus cereus. They will cause you vomiting because someone reheated rice, Chinese fried rice, something they will give you. Last one here, sorry, I'm erasing this part. Last one more bacteria, very important. That is called someone going for camping and all. That is called the Giardia. Someone going camping and drinking fresh water. From fresh water, we can have this. Next one is about invasive type. Invasive, first one, Salmonella. Like from unboiled eggs, or from poultry and all, or dairy products. Then Shigella. Then E. coli 0157H7. Then remember, they will cause you hus. It is from uncooked meat, normally uncooked meat. Then Campylobacter jejuni. Then Entamoeba histolytica, liver abscess, they will cause you. Then cryptosporidum in AIDS patient, cryptosporidiasis in AIDS. This all can cause you what type of diarrhea? Invasive. So remember, whenever a patient comes to you with the signs and symptoms of diarrhea, you check if it is a viral gastroenteritis, normally common in every people. It's a viral diarrhea. Give them IV fluids and anti-diarrheal drug like loperamide. We give the patient loperamide. Now, if it is not viral gastroenteritis, you are seeing some alarming sign, that is bloody diarrhea. Patient is having fever more than 104 Fahrenheit. Patient is immunocompromised. Or patient is in hospital already. These are called alarming signs. So you should start what? Investigation. Among investigation, first thing to rule out will be Clostridium difficile. It is very easy to find out because already they will give you some history of antibiotics. So give them what? Oral vancomycin, and if the patient have this infection again and again, for refractory cases, even we can do fecal transplant. Fecal transplant for what? In the case of refractory, again and again this is coming. The case of refractory cases. Then, it is not Clostridium difficile, check for RBC, WBC in stool. We call it as lactoferrin test. Lactoferrin test. If there is positive lactoferrin, we already talked, there is like RBC or WBC, we call it as invasive type. If it is negative, it is what? Enterotoxic. In invasive, remember, you do stool culture and colonoscopy. In stool culture, if culture positive, right, and colonoscopy negative, it is infection. Give antibiotics. Instead, is culture negative but colonoscopy positive, it is a chronic medical condition. So you have to go like maybe IBD or something. So that's about invasive type. In enterotoxic, right, you check if there is ova or parasite. If you find ova or parasite, again give antibiotics. If you don't find any ova or parasite, say like diarrhea itself, so you can give again IV fluids and loperamide. So once again, if you see RBC, WBC invasive, you do stool culture and colonoscopy, culture positive and colonoscopy negative infection antibiotic, culture negative but colonoscopy is positive chronic medical condition. If enterotoxic, you find for ova or parasite. If you see ova or parasite, give them antibiotic. If negative, give them IV fluids and what? Loperamide. So this is how you diagnose acute diarrhea and manage it. That's all about what? Acute diarrhea. Thank you.